because I don't want us to run out of time. Seeing with heart is kind of a surprise outcome of, like, I would call it, some people would call it a huge obstacle. You had an accident, you had some surgery, like initially was, I want to say minor, was a smaller length of time surgery in the surgical arena, so to speak, or theater as they call it, and then you had to have another surgery later. And in the recovery of the second surgery, which I found interesting that you chose to be fully present for it, and I like the way you say that your knee was making noise instead of using the word pain, because it shares with you what's going on. So then we can flash to and let you tell, during the time of the noise and the recuperation period, you picked up some white paper or a folder and began. You can tell the rest. I don't want to give up your story.
It's okay, you're doing a beautiful job.
But I mean, you started to have some guided writings come out, which is the result is this wonderful book, which I'm going to hold up right now, Seeing with Heart. And as when Dr. Mitch shares a little bit more about it, I will hold up some of the selected guided messages he got, poems and things. And then you can tell the fascinating part. I think it's fascinating that months later, 18 months later, these were able to be some of your healing or help healing other people. So I'll just do this. Yeah, I'll do the circular one first, I guess. Getting it? Oh, sorry. Go ahead, Marisha.
It is interesting that you mentioned that I was in something that most would categorize as an accident, and something that I hear is that there really are no accidents, and so there is blessing in all that occurs. And you know, from that situation and the 2 surgeries that were required to stabilize my leg, and inviting myself and giving myself permission to be present, fully present, to not medicate, to not have any sedation, to not have any general anesthesia, to be present with both of those procedures. And so then it was, as you mentioned, after the second, more involved 4-hour procedure, that a couple of days later I had this compelling feeling, and it was very interesting because it wasn't an anxious feeling. It was a very urgent feeling to get a blank piece of paper and put a pen in my other hand, which to that point I had never had the feeling to do that. And it's interesting because these writings that you're sharing right now, you can see are really quite legible, and my dominant handwriting is essentially illegible. In fact, I'd often go to my business manager and ask her what I wrote. She's been running my office in my life for 30 years, and I'm like, geez, what did I write here? But these writings came out completely legible, and each one, it was very obvious that they contained potent messages. And so when patients would have a question in the office, I would remember that there would be a writing in the collection that would directly support their question. Because initially when these writings came out, I just simply put them in the floor of my closet. I didn't really have any agenda to create a program or to do anything with them. They just were occurring. And so when I got back to practice after my knee stabilized, like I said, I just would respond to patients because they would ask a question. I'd photocopy the writing and hand it to them. And after patients started to get small collections, they asked if they could sit down and talk more about this material, and that's how the Seeing with Heart journey emerged. It wasn't like a program that I created, it just naturally manifested itself.
It kept, were you surprised?